project is on how does ADHD affect the brain. My thesis is I will inform you about what ADHD is, how it specifically develops and affects the brain, and what are the treatments for it. According to the CDC, 9.4% of children between ages 2 to 17 are diagnosed with ADHD. ADHD has been increasing over the years due to the experiments and data that doctors and scientists recorded and discovered. The reason why I chose this topic is because I have ADHD and I wanted to find out more about my disorder, also about why is it increasing over the years, and how does it affect the different and several parts of the brain. Some background information is what does ADHD stand for and the definition of ADHD. It stands for Attention Deficient Hyperactive Disorder, and it is when a child or a person or an adult is very hyperactive and has a very short attention span. People with the disorder have behavioral issues and have a harder time to focus in school and doing tasks outside of school. And we can see here that there is a chart that proves that it is actually increasing over time. And you will see this chart later on to back up more about how is it increasing. But in this chart, you will see from the year 2003 to 2011 how it slightly increases in the ages, which is noticeable for diagnosing a child with ADHD. History of the diagnosis and cases compared to back then and to now. Sir George discovered the disorder, but there wasn't any medication until 1937, which was invented by Charles Bradley. And it stated that ADHD diagnoses were not common back then because of the lack of medication to help with the mind. And actually, some people didn't actually believe ADHD was a thing. They just thought that it was due to bad parenting. But now we can see that there actually has been evidence and backup that ADHD does exist and that there is technology and experiments and treatments and tests of how to help treat ADHD. And here we have data on the diagnosis. And what these charts are actually, I have 3 charts here, and they're actually just stating that like how an ADHD person has difficulty staying focused, paying attention, difficulty controlling behavior, and is really hyperactive. And there is this chart right here, and this is actually the prevalence of ADHD among U.S. Adolescents between the year 2001 to 2004. And you can see that males actually are more likely to get ADHD because simply because they have way more signs and symptoms that healthcare professionals can notice it right away. And where girls, you can see less of the symptoms and signs. And that is where it is really hard to detect the diagnosis in the girls. And all these charts are separated by age, sex, and ethnicity. You can see here again, this chart again, it proves that how it is more noticeable now in younger patients, and where back then they thought it was only in teenagers, and they never thought adults could get it, but that is not true. You can see here that there are ages above the adolescent years. And about 6 to 10 children with ADHD are likely to have or already have another mental disorder. Whether that be even like Tourette syndrome. And you could see on this chart right here that that the percentages of children with ADHD and another disorder, that 64% of children, they have another emotional or behavior disorder. And 52% have behavioral conduct problems, like rather within school or even with other people and relationships. They don't have that good of a social skill to work with others. And we can see 33% have anxiety, depression, 17%, 14% autism spectrum disorder, and 1% Tourette's. So yes, there is other mental disorders that could go along with ADHD. How does ADHD develop, or how does one develop ADHD? And basically, the truth is, doctors and scientists, they don't really know how one develops it, but they do have hypotheses, and there's so far there is two of them that they have really looked into, and one of them is genetics. And so if one person in your family were to have ADHD, and it could get passed down as a characteristic trait, and that's how you may develop ADHD. And one of the ways is that not only is it partially genetic, but the other way is that it's through pregnancy problems, and there's risk factors when you're pregnant that you could be harmful for your child and develop ADHD. And that is if the child is born prematurely, if you're underweight during pregnancies, or if you drink or smoke during pregnancies. Spectrums of ADHD and some other signs and symptoms. There are actually, believe it or not, there are 3 different types of ADHD. Predominantly inattentive, which is hard time focusing on task or following instructions, doing things like without being told, not paying attention in class, not following their simple routines, constantly forgetting what they need in life, like what they need actually, like a morning routine that they forget their homework all the time, for example. The second one is predominantly hyperactive, impulsive presentation, and that is this person with ADHD will tend to talk a lot, fidget. They can't sit still for long periods of time. They tend to interrupt others, and they tend to get out of, like, for example, in class, or even if it's a really important thing, they tend to either talk out loud or that they get out of their seat without being told. And the third one is a combination of the two. And it's really the hardest to cope with if you have the third one, which is a combination of hyperactivity and inattentive, because you have both of hyperactivity and a short attention span. And that could be really difficult to do schoolwork, especially if you're not medicated or if you don't have any treatments for it. Medication and treatments. There are very different therapy. There's different types of therapy, I should say, to cope with ADHD, because there is, believe it or not, there is no cure for ADHD. There's just different treatments and how to cope with it. So one of the ways that you could cope with it is child behavior therapy and parent behavioral therapy. And this really helps. It helps a child develop positive emotions and when to use them to help build certain relationships within school, within your community and neighborhood. And the second type is both a therapy and medication, where you just be the same thing as the first one or the next one I'm about to introduce, and it's just the same thing except along with the medication. And then the third one is cognitive behavioral therapy, and this type of therapy helps your child focus on to your negative emotions, go to positive emotions, and it's all about the mind. And sometimes with that you can do like meditations or certain things, and that one is more about the cognitive skills and try to help develop stronger like detail-oriented and hard worker as a well-rounded student in school. How the different types of medication affects the brain. There are actually 2 different types of medication: stimulants and non-stimulants. And stimulants have narcotics in them, and what a narcotic would do is it simply helps the central nervous system stimulate and function well. And the reason why doctors will give you narcotics is it helps increase the brain chemicals. And a narcotics usually increases dopamine and neophramium, which is adrenaline, and it helps it helps a person concentrate and complete simple tasks. It helps. And where non-stimulants is people would take if a stimulant was not working for them, or if they did not like the side effects it was having on that person. Again, every person is different with medication, and sometimes they don't want the harshful and crucial way of narcotics affecting their child's mind, or even if it's an adult, their mind. Oh, side effects of different medications. So for this list, we have stimulants, and it is usually headaches, nervousness, trouble sleeping, irritability, weight loss, decrease in appetites, and delaying growth. So with side effects, with any medication, you don't always have the same ones. Not every person's going to have the same one, and it all depends on the patient. And there's a case study that Dr. Raymond did, and her study was on how crucial is the stimulant for the brain. And she replaced the stimulant with a placebo, and she split people up, men and women, to give them the placebo and the stimulant, and they both had almost the same effect. They both increase the white matter in the brain. There are different regions of the brain that are affected. So the main part of the brain that is actually affected by this is the prefrontal cortex of the brain. And usually that helps with this quote right here that says that part of the brain functions receiving memory, sensory, initiation, performance, coordination, and voluntary and involuntary movements, to regulate moods and emotions, behavioral control. So if that is not working in an ADHD person, what will happen is that their brains won't signal depending on the situation, how to respond. They really don't know how to respond. They may respond in a harsh way or a different way where other people wouldn't understand. And yeah, like here, again, different emotional ways how people can act, and with the prefrontal cortex of the brain. And I'm about to show you another two more charts about the brain. Again, we can see how the different tests of how different people react. The MRI scannings down here, which up here we can see on this chart the different parts of lobes of the brain, we would say, the different lobes. And when transformation is getting when information is getting transferred throughout these different lobes of the brain, they are transmitted by neurons and neurotransmitters. And usually with ADHD people, not all the information is retained. Not all of it goes through each and different their frontal lobe. So that's why they have a harder time understanding, and their behavioral issues sort of act out. And that has to do with the different chemicals within the neurotransmitters, like dopamine, for example. And also in the frontal lobe, you can see that they do not fully mature at all. We could see that in the frontal lobe, right here, an ADHD person's mind, or brain, I should say, their structure and function at in teenage years, it should fully develop their brain, or in their brain in the frontal area. It should be almost fully developed, but an ADHD person, it is not. They won't do that until later life. And we can see right here, this gray area, it is basically that ADHD is proving that ADHD is a decrease in blood flow and a decrease in oxygen. And when that happens, that is why the neurotransmitters, they cannot react properly and behave properly, a person in a situation. And if there's a decrease in that, then that's how you know that there is a problem within the child's brain. And it's hard for that person with ADHD to complete different things. This gray area usually detects the brain volumes, where it's circled right there. And it also shows the difference in the cortical mutation in ADHD people, which they have delay in. right there. And this is how it would normally respond. My conclusion is over the years, ADHD, the reported case on ADHD, it proves that it is increasing, and that it has to do with how our brains develop over time and the chemicals in the environment, genetics, and other behavioral disorders. There are different treatments to help cope with ADHD, but there is no cure. Today, scientists and doctors are still doing tests and studies to figure out more ways for treatment and to prevent ADHD from developing.